Hi everyone, I am Cindy Paul, Executive Director for Truth in Health, and today we are joined by Kallie from Hydro Hero, and she's also the champion behind Wellness for EMS Expo. When was that? What was the date for that? It was last month?
No, it was in May. So I guess it wasn't in last month.
Yeah, so it was last month in May. And so I want to introduce everybody to Kallie, and I want to introduce you to her company and cause, I guess we would call it. It's not really a nonprofit, right?
No,
it's just
just a cause.
So today we are with Kallie, and she's been a paramedic for 19 years, you guys. So we're going to hear a lot about that experience and what she's learned through that, and what she's seen in some of the difficult times for people, because she sees people at their worst sometimes. And that's got to be hard. And so we want to hear from Kallie, and we're going to ask her some questions, and we're going to learn a little bit more about what she's doing with Wellness for EMS. And then I really want you guys to understand what Hydro Hero can do for you, because there's a lot of amazing stuff that she's doing. And we need to highlight that because she is a directory member at Truth in Health. And that's what we do, is we really work closely, and we want everybody to understand who our founders and members are so that you know where to go for your health. And so, Kallie, we're going to kick it off. And I'm really excited to talk to you because we know each other a little bit, and I'm starting to know you more, which I'm just adoring you. So
Well,
the more I learn, the more I love you. And so how did you get started with EMS?
I tried to avoid it, to be completely honest. My dad was an EMT, actually working as an EMT when I was born. And so growing up, that's kind of like all he talked about it. And I did not want to do it in the slightest. I was just like, I want to be something different. I don't want to be like my dad. But living in California and going to college at that time was hard. And so my connections were through parents, because that's typically how it works when you're young. Dad's best friend had a job opening for a dispatcher on the weekends, which is what I needed. In school full-time during the week. Yeah. I played water polo for college, so I had practice. I couldn't go to work after school. Weekends were really all that I had. And so he was like, well, I got a job for you. 17, 18 years old, making $12 an hour was really nice, especially at that time. Mm-hmm. And so that's how it got started. It was just supposed to be a part-time job. And then they're like, oh, well, California just changed their rules and you have to have a certificate to do this. And I was just
to be a dispatcher?
Yeah.
Oh, wow. Okay, yeah. So they changed it right in the middle of you getting in there.
Yeah. They're like, you have to either go get your EMT license or you have to take a dispatcher course.
Okay.
And so I was just like, well, dispatcher course sounds boring. And so,
at least you're honest.
I mean, the job itself was boring. It really was. The way that California operates things, it's not as what you see on the TVs.
Right.
So it's different. It was really boring. And so I was like, EMT sounds better. And so I took the course and I actually enjoyed it.
Okay. Nice.
I was just like, I'm learning things and this is helpful and I like this. And
it takes a special person to be a first responder, to put yourself in those kind of situations to help others. And you're putting yourself at risk sometimes. And so I just takes a special person to do what you do. What are some of the things that public doesn't understand about the EMS profession?
We're not a taxi.
Yeah.
And
you see all walks of life, don't you?
It's people don't understand that we are actually professionals. We have the education behind it. We are not just here to transport you somewhere. We can't just load you up and go. We have our own assessments to do. We have our own things that it's more than just vitals that we're looking at. A lot of the time they get mad. Well, just take me over there. I'm not answering your questions.
Oh, goodness.
Yeah. Okay. And so a lot of it is very much that education piece that we're not just a taxi driver. There's certain levels of hospitals around. Mm-hmm. We only have one level 1 hospital here. If you have something that's a level 1, we have to go there. There's only one burn center.
Interesting. I don't think a lot of people understand that you are kind of bound by the facility's capacity. Correct. Or whatever they're able to do for that person. Correct. That's interesting. I didn't even really know that.
There's each hospital kind of has their own things. Like the Edmond Hospital, you can only take up to certain things to those hospitals. Okay. So if somebody says, well, I want to go here, I can't take a stroke there. Our closest stroke facility from Edmond is Mercy.
Gotcha.
And that's where you're going.
And you don't want to waste time for a stroke victim. You want to get them there quick.
Yeah.
In EMS, you're often seeing people on their worst days. What patterns were you seeing repeatedly in the field?
A lot of it was they were ignoring their signs initially. They wait days, sometimes hours if it's a severe, but they wait days to do something about it. And by then you're putting yourself in a lot worse situation than if you would have followed up even with preventative care.
Mhm.
I'm not saying that you had to call an ambulance sooner. I'm just saying you could have gotten to the doctor. You could have refilled that prescription. You could have, there's a lot of things that you could have done to prevent it from happening. There's always going to be those one-offs. This is not the ones that have a sudden incident. This is not what I'm talking about.
Right.
Most of the patients, it's repeated symptoms. We've ran on them several times for this issue. They're not listening to their body. They're not listening to their doctors, and they could have prevented this.
That's right, because you would see some of the same people, because you would get some of the same calls, because you're right there. That's interesting. And what lifestyle habits seem to create the biggest health challenges?
Oh, for sure, dehydration.
I would agree with that.
Summers it comes out more than often than not, but in general, it's absorption stuff in general. They try to keep fluids down and they're just throwing it up.
Right.
And so a lot of it has to do with our body and the metabolism process. Some people, process things faster than others. Some people, it takes a very long time. Pretty much all of the issues that we have there's some sort of either metabolism problem or there's some sort of pump problem. Things are just not operating properly.
Wow. Yeah. People in our practice, we see that too. A lot of people just don't know how to take care of themselves anymore.
For sure.
But that's what we're doing. That's what we need to provide. We need to provide that education so people understand what they can do at home. And hydration is such a big one. Do you think our healthcare system spends enough time discussing prevention like hydration?
Not at all.
When does your doctor tell you to drink more water?
My doctor doesn't tell me to drink more water.
That probably should be part of what they're telling us to do.
Very much so. I've had some good doctors, but I've also had some ones that you can tell are just trying to get me in and out of the office.
Right.
And I think that that's kind of the problem, at least that I have found in Oklahoma, because I've worked in other states. And in Oklahoma, everybody's just trying to get in and out and get on with their life, that they're not taking the time to ask the questions on why am I being prescribed this medicine? Is there what are the side effects? Yeah. What can I do that's maybe not a medicine that could help? Or is there something that I could do to get off this medicine?
Yeah,
whether
prevention.
It be perfuming. Exactly.
No, prevention and regeneration needs to be a topic that our physicians and medical establishment starts to adopt in their minds instead of just symptom management.
Exactly.
Let's do preventative or regenerative. Let's help our people better.
Yeah.
When you're seeing some of the same issues and some of the same calls, and I know that's got to be hard on the first responders, because you just see people are struggling. And so that probably feeds into burnout and things like that. And so I want to ask you, what health challenges do first responders face?
I would say there's two main things. One of them, they try to help us understand, but the other one, not so much. I would say nutrition and just general health is very hard. We're especially in the Edmond area. And I will also say that with EMSA too, you're nonstop going.
Gotcha.
You don't have a cooler that can actually stay cold. You don't have a way to heat up food. So what are you resorting to when you're eating?
Gas stations, fast food. Yeah. All the bad stuff.
Exactly. You can drink water, you can have things like that. But at the same time, you're also exhausted. And so what are you going to do? You're going to slam an energy drink. I'm guilty. I can't tell you how many times I pull into an on-cue and that pizza it's the best thing right now. And a Red Bull.
Right.
And maybe even a chocolate bar because I need something sweet. I'm 100% guilty of it. Everybody's like that because we don't have, and then we can't meal prep. By the time that we get home from working a 14, 16-hour day, the last thing we want to do is sit there and prep food for the next day.
Exactly.
We want to shower and go to bed.
Yeah. And you need to decompress.
Yeah.
And let out everything that happened in the day.
The only other thing besides that is mental health.
Right. So how does the stress impact EMS professionals?
A lot. We have been categorized in the same category as military when it comes to PTSD. After being in EMS for 19 years, I can tell you it's completely real. That's one of the main reasons that I've stepped away, is because my mental health is important. You need sleep. And when you're not sleeping because you hear the cries of moms after you just told them that their kid died, or what you see on the side of the road, those are all real things that pop up in your head. EMS as a whole doesn't take mental health seriously. We don't get time to decompress before we jump into the next call. We're still expected to pay extremely high costs to get somebody to help us process that. And so a lot of the time we don't have the time off or the funds to be able to get that help. And so it builds up and
Wow.
builds up and builds
Yeah.
up.
And so that's, the state and the counties and cities should, band together and figure out how to make that a little bit better for our first responders. And that would come with more funding from somewhere.
So that's where I would say the biggest misconception is that people will put EMS ambulance crews with that. We're privately owned.
Private.
So we don't get any of the same benefits that fire and PD
So
do.
no state funding and oh wow. So
we don't get health benefits, we don't get pensions, we don't get retirements, we don't get any of that. We don't even have a union. No, we don't get any of that because we're private.
So none of those protections for labor or pay or any of that.
Correct.
None of that's there. Well, that's a little bit backwards. I would think some holes we need to fix for sure.
Yeah.
That definitely, you can tell me what burnout looks like then.
Burnout for a lot of people presents differently. In the EMS world, burnout can resort to drinking.
Yeah.
In some cases, drug use, but most of the time, it's not your typical drug uses. It's ones that Benadryl, things like that EMS is very familiar with. Not going to be your typical fentanyl and things like that type of drug use. Divorces, things like that. It's going to present in different ways because we feel alone. We feel we don't have help. Don't ask for help. We're used to helping others, so we don't ask for help.
Yeah.
And so burnout is a lot of the time presented in a different way than what the average person is going to see.
Yeah, no, that's concerning because I know that, we all depend on our first responders and we want them to, be healthy and be at their best. And so tell me a little bit more about Wellness for EMS and why you put that together.
I've reached burnout. I've been at that burnout stage for a while. I've taken breaks to try to fix my own burnout. Didn't quite work because we all have, it's in our DNA that we are meant to help and we are meant to do these things. I wanted to find some way to continue to help people with the resources. Like I said, we don't ask for help. We're not going to Google and figure out how to find these things. However, we are going to listen to other people in the field, referrals and things like that. And so by putting something in front of them and saying, hey, I don't know if you know about this.
Right.
That way, when the time comes, when they're by themselves, so that nobody knows that they're reaching out for help.
Yeah.
They can come out and they can reach out for themselves in a secretive way. That's not most of the time how it's going to be. Or they're embarrassed because they think that they can't handle things.
Right.
They don't want to admit that they're wanting to stop a drinking problem. They're not wanting to admit that their health is at risk, because as soon as your health is at risk, they're going to take you off the track, which means you don't have money for your family.
That is true.
So,
yeah, you got to be healthy to be at your best, or that's what we think you should be anyway.
And so I wanted to put this together as an option to being like, hey, this is where everybody's at that wants to help you. It's a one-stop. Like, just get all the information. You can look at it later. Just get all the information in front of you.
Was the event for first responders?
Yes.
Okay. And so is that kind of why you put it all together, is to give them a place to find those resources?
Exactly.
Okay.
I wanted to put anybody that had something that could help. We had some healthy nutritionists, we had some gyms, some stretching, chiropractors. We had supplement companies with all natural stuff, healthier protein and energies and things like that were better alternatives than Red Bulls and, on cue pizza. We just kind of wanted to put it all in front of them so that they can understand that there's options. And also at the same time, if they had a discount, because EMS is a very underpaid service. So anytime that you can get a discount for something, it's helpful.
Is their ballpark around $15, $20 an hour, or is it better than that?
Services are different. Each service is different. EMTs are about that 13 to 16 range, depending on experience. Paramedics are that 18 to 20 range.
Yeah.
So it's definitely not where I think it should be, especially with all of.
When they're caring for people, definitely we should be taking care of them a little bit better.
Yeah.
Yeah. No,
that's a whole other topic. I can go down that bridge.
That's a whole nother show. We'll save that for later. What did you learn from that experience?
I learned that there's way more people, like the outpour that we got. We were actually turning vendors away.
Wow.
Which honestly was very exciting in a way, because I was like, there's so many people that want to help, and there's so many people that have something to offer. Things that I didn't even know about, and I've been networking for years. I'm definitely looking forward to where it can go and getting different types of people in there. I also learned that you kind of have to kind of force their hand a little bit, the first responders, because they see expo and they think of something different.
Right.
And so we've definitely learned the verbiage needs to be a little more inviting. But in general, I just love the upward from the community on how many people were wanting to get in front of them and help them.
Yeah, no, I loved it. I was there and I got to witness it. And yeah, there was a really good flow of the vendors were amazing. And you were right. Every single one of them had a big heart and they just want to help. And when you learn about what our EMS workers go through, then it's just like, how can we not help? You know, we have to be there for you because you guys are there for us. I want to talk a little bit about some of the vendors. I know you've mentioned some of those vendors were first responders.
Yeah.
And so they're opening their own businesses, or are they moving away from being a first responder and now being a caregiver?
A lot of them are.
Okay.
I found that a lot of them kind of do what I did, where they have one foot out the door because of burnout, but they can't leave the stability.
Yeah, no, that would be hard to do.
Yeah. And so it's, what can I do that can get me eventually out the door? And that's where these start, is because you have to run your own business with the flexibility of the schedules, working 12s or even 24s.
Mm-hmm.
You have to have flexibility. In a normal, having a second job or another job that you can't, it's hard to do that. So starting your own business is definitely the way to go. And a lot of them have done things like a roofing company, a lawn care company.
Okay, so the trades.
Yeah,
That's
a
nice.
lot of them have done the trades. At the expo, we had some that were doing other types of nutrition stuff as well. That's also been really good because, again, experience and professionalism taken into account of who you're, getting information from. It's actually a healthcare professional and not just a salesperson, which has been really important. I mean, some of them are just, they make small little gifts, but takes their mind off things. So it not only helps their mental state, but it also helps
kind of their therapy in a way. Well, I'm glad that they're finding that avenue to kind of help with that, because that would be hard to, if you saw something traumatic, it would be hard to kind of let that go. So I'm glad that they're finding those avenues. And so do you think people in EMS develop a unique perspective on wellness because of that?
I would agree. I think they do. They have seen what happens when things are not well taken care of. Mm-hmm. They also understand the good and the bad of different things. Even let's just think about water. We know what happens when you don't get enough water, but a lot of people may not understand that too much water can be a problem as well.
Or the wrong water.
Exactly. Sodium is a very crucial thing that your body needs. It is one of the key components what makes your heart work.
Yeah.
But at the same time, too much sodium can also cause some major problems.
Yeah, and there are these RO systems, and there's good salt and there's bad salt. And we see the people who use the good salt have less inflammation, and the bad salt kind of elevates that. So we're seeing that just in our scanning. So that's very interesting. What are some of the examples of businesses started by first responders that you think will want to come back to your Wellness for EMS?
LifeWave. I actually worked with that paramedic several times through a couple of different agencies. Him and his wife run that business, and the science behind the LifeWave patches and things like that have been, great for them. He started using it before they started selling it. We also have a couple of nonprofits.
Okay, we got to support the nonprofits. Yes. They do good work.
The On Call Project and Warriors Rest were both started from EMS professionals. One of them was from an Edmond police officer. And so we did have him at that event as a nonprofit. And he's starting a movement that's all about the mental health side of stuff and getting first responders to get that purpose through starting businesses and helping them start businesses.
Oh, nice. Yeah. Oh, that's a huge thing. And so that kind of leads me into the Health and Hustle event that we're working on together. Do you think will he come to and be in your experience at Health and Hustle?
I think he has a conflict because he is traveling. Yeah, he is traveling a lot to try to get the word out. He's the only one that does this in the whole nation. So he's definitely trying to get it out. So he'll be there in spirit probably. Yeah. He says that he might make it there.
Okay.
He's definitely a key component behind helping us get more EMS ran vendors at this event.
Very good. And so real quick, Health and Hustle, Wellness for EMS is going to be a nice experience at Health and Hustle, which we're hoping to get some of her vendors she had in her May event in her little area. So there will be a special area just for all those first responder owned businesses and for wellness for EMS. So we'll create a nice area for you and designate that so people will know when they're in the wellness for EMS area, so they'll know to give more support and maybe spend a little bit more time talking with that vendor at Health and Hustle. One reason I wanted you on the show is because Health and Hustle is trying to create a similar bridge. So we really want to help our first responders, our community, and anybody who really needs help find the resources they need. And so that's what Truth and Health has been doing, several events, but this Health and Hustle one is really the first one where we're bringing together business, first responders, and the networking groups, which I think is kind of unique. The networking groups, they're all first responders, small business, and wellness. So we're all in the same groups and we all see each other all the time, but we don't actually network together. And so I really see this as a good way for us to really further those connections and show our community, how to live a little bit better. Why do you think business and wellness belong in the same conversation?
I would say that wellness is very big on education. The more that you know, the more value that it holds. Mm-hmm. And you're more willing to do that thing or buy that product or use that product if you understand it.
Right.
And so when you put those two together, you're not selling. It's just educating. Mm-hmm. And then they're going to come to that realization that they do need this, that their body is needing that. Or when it comes down to it, small businesses are where everybody should be shopping to begin with. Yeah. And so when small businesses have the time to educate and talk and things like that, that's going to help their business and in turn help the people that they're really trying to help by helping them understand what their body's saying.
Yeah. Yeah. No, I agree with you 100%. And so how does poor health affect someone's ability to work, lead, and grow a business? Because you've got mental health, PTSD, all kinds of issues coming from those first responders. Do you think that when they are able to dive into creating something new, does that all kind of go away or does that stay with them?
So I've been off the truck since April. I will say that even in just this short amount of time, being off the truck has just given me more energy. Mm-hmm. It is created, I've taken the time to eat properly, to sleep properly. And when you do all those things in general, your body is naturally going to start to heal. And in general, you're going to be more awake. You're going to have more energy. You're going to have better thoughts, memory, all of that stuff. And so when your body is unhealthy, it's going to be dragging on. You're not going to be able to think. You're not going to be able to sleep. And then it's just this onward cycle by making even just small little choices, eating healthy, making sure you get those 8 hours of sleep.
Right.
It's going to create, endless possibilities, which in turn is going to be, let's get this business, let's actually get some stuff done today.
Yeah, having purpose every day is kind of the driving force behind many things. I know for me, if I don't have purpose, I'm not going to get much done. But that's why community events are important too, is to bring us all together. And so we know what resources are out there. And so I'm excited to partner up on this with you because I think by bringing together wellness for EMS and then also the Health and Hustle and everything at Truth and Health, and then Mix and Mingle and BNI. And now I've recruited Clayton Valley. So nice. He's going to help us on the advertising side. So we've got a really good group of people putting this together. And so I think you're going to bring something very unique to the show. And so I'm excited about that. But I really want people to understand what you do for business. So you left the truck, but what do you do now?
So I do IV therapy and we're mobile. So I pretty much do what I was doing on the ambulance. I show up at your door, make you feel better. Okay. The difference is that we don't have to go to the hospital. I can make you feel better from the comfort of your home.
That's nice. People will just relax better and think having those therapies in your home is just a better way of doing it. So when you go to the hospital, it just feels so clinical. And what you do is kind of, it can be very therapeutic and recreational. So
very much.
Yeah.
Very much.
I guess it was your journey as a first responder that led you to Hydro Hero, or what initiated that?
Well, I mean, as most things, when you're working in EMS, you don't take care of yourself. And so somebody has to take care of you. My wife also works on the truck with me, and we met in EMS, and she does have some health issues that don't get addressed because, again, she's a caretaker.
Mhm.
And so I've had to be her advocate. Doing so, we had found that her body doesn't metabolize things properly. She burns through her sodium very fast, which in turn creates heart problems.
Right.
And so we were like, okay, well, knowing my research, and we ran all of our own tests and things like that, she highly benefits from just a bag of fluids. That is great. And you would think that we have it handy being on the ambulance. It's still not our stuff. We still can't just use it whenever we want to. And so I
Right.
had to look elsewhere.
Yeah.
And I was like, what can we do? Like, how can I get this regularly? Not being able to go to the doctor's appointments and things like that, working the shifts that we do. I found several companies that did it. And so I was just like, well, this is great. I like this.
Yeah.
I was like, well, maybe I can do this. Like, I want to be helping people like this.
Well, you've
And-
got the background to do
Exactly.
it, so no reason not to.
Yeah. And Mobile IV was a company that was coming to Oklahoma, and they were the first ones that hired paramedics that I found. And most of the other ones wanted nurses. So when Mobile IV came, I jumped on it.
Mhm.
They came to Oklahoma September of last year, and that's when I got on board with them.
Very nice. That's very cool. I'm glad you found them. Sometimes people are brought together in a divine timing. You mentioned your wife. How did your wife's health journey influence that decision?
I think I saw her eat like a full burger once.
Was she not able to do that
Um,
before?
No, she just fatigue and the gut problems and just everything. Like, it was hard for her. She didn't have energy.
Mm-hmm.
I mean, she has her own mental health and her own things that she's
We all
dealing with.
do.
But on top of that, you should be able to eat and have the energy to eat and just do things. And so after the thing of fluid, she actually had energy. She was running around, things like that, just seeing that turnaround.
You're like, this is a different human.
Exactly. It was great. Her heart rate was actually maintained. We had the ability to kind of look at a 12 lead before and after and kind of compare
Yeah.
notes and see things on a different level. Seeing her turn around, like, she's actually going after dreams right now. She went back to school
Okay.
after something that she's, never
That's
thought
exciting.
that she was able to do. And she has a clear head and, things like that. And so just seeing this motivation that I haven't seen, all because we just kind of gave her the fluids that she needed.
Yeah. Isn't that amazing? Give the body what it needs and it'll fix itself.
Yeah,
The body is a miraculous healing machine. It really is. We just get in the way too much.
exactly.
What are all the typical benefits from IV therapy? Because I know there's hydration. What are the other benefits?
So we have all the vitamins that your body needs on a daily basis to properly function. We have the common B12 and vitamin D. People don't realize, but those are two very important things that your body needs. All of our vitamins are very important in what your body needs. Chronic fatigue, mood, all of those things lack vitamins.
Yeah.
And so if your body is, how do you run a car if you don't put oil and gas in it?
Exactly.
And that's exactly what I'm doing is I'm putting the oil and the gas in there.
Yeah.
And so when I'm just giving your body naturally what it needs, it's going to function properly.
Yep. Nope. It does. It just wants to heal itself.
Yeah.
We weren't built to break. We just get in the way. We have a horrible food system that doesn't support our
Exactly.
health anymore.
Our foods are not packed with the nutrients that they should be. And so we're not getting those.
That's right. Reason why supplementation and the IV therapy and all of that is something people should consider. Because
Yeah.
if they're not feeling good, it is probably a mineral depletion or just some simple fix of just fixing the nutrition and quit eating that fast food or that gas station food.
Exactly. Exactly.
And so what safety measures are important when having IV therapy?
With any, medical procedure, there's going to be safety risks. But because we are trained the way that we are fully aware of those. And we take the extra precautions of making sure that we don't put too many vitamins in there, that the vitamins are being pushed the correct way, because some vitamins are too potent and too acidic to go directly into the vein. We have to put them through the fluids. That way they're getting absorbed naturally.
Right.
And so knowing those is very important. There's literally a case going on right now where a medicine that was supposed to go in a bag went through the IV and killed somebody.
Oh.
And so
man.
we study these things. We know these things. We know not just the good of things, but the bad. We know what happens, what to watch for. And we also have means of fixing it.
Yeah.
We carry an emergency kit with us. So
what is that
something
emergency? What is that?
So it has epi and
Okay.
solumedrol, and then we also have other things that might be needed,
Okay.
like Pepsid and stuff like that. But we do carry just in case there's some sort of reaction that happens. The solumedrol is good for respiratory if there's any sort of respiratory problems. We also follow up. We have a doctor. All of our orders come from a doctor.
Okay. So it's doctor supervised.
Yes, but our doctor is a naturopathic doctor. So very understanding the the vitamin side of it and
Yeah.
things like that.
He has that natural mind instead of
Exactly.
just the pharmaceutical mind.
Exactly.
Gotcha. No, that's good to know that you've got those protections in place and you know what to look for. One wellness habit everybody should adopt.
I mean, I want to say drinking water, but that just sounds too easy.
I think that's a good one to say to me because I just told you, I was like, I might drink one glass of water a day. It's because I don't give myself time to do things. I don't make time for me.
Yeah. I would say that there's different ways to take vitamins. So take the vitamin that's going to give you the most effectiveness.
Mm-hmm.
If you're trying to repair your gut, you should be taking something orally because where is it going to be absorbed? In your gut, where it needs it. If it's going to be something that you want long term, it should go in your arm, where in the muscle, so that it can be dispersed over time.
Slowly, that's kind of like that slow release.
Exactly. If we need something rapidly that kind of needs to go directly where it needs to go, it's ideal to go into the bloodstream. Let's go ahead and put it right into the bloodstream.
Yeah, that's when you pass Gandalf.
Exactly. Utilize the most effective methods, and that's how you should take your vitamins.
Been taught how to provide those to people, and there's reasons for it, and it's absorption and all of that you just mentioned. So what's the biggest mistake people make with hydration?
They think that if they drink all of the water at one sitting, that's the best way to do it.
I am hearing your advice. And so coffee and energy, I start my day with, I drink a glass of water before I drink my coffee. But then the rest of the day until I get home, I don't drink anything. And so then I drink water when I get home. What do you think about coffee and energy drinks?
Oh, I rely on my coffee. I don't function until I have my coffee.
I love my coffee.
I need it. My son has learned that I need to have my coffee before he says anything to me.
Nice.
So
taught him well.
Yeah.
What is your best advice for first responders? Hopefully they're listening to this.
It would be to take care of yourself. We are literally taught. The first thing that we're taught from day one of EMT school is safety first, put yourself first. And it's something none of us do.
Yeah, no, those are wise words. And we always need to put ourselves first because otherwise we'll be last all the time.
Exactly.
Even if you're a first responder, you have to think of yourself too and not put yourself in harm and also protect that patient you're trying to care for. And so how can people learn more about Wellness for EMS?
So we are going to be at the Health and Hustle for
Yay.
one, so they can definitely come out to that. But we also have a Facebook.
Okay. Oh, good. So what is that? Is it Wellness for EMS?
It is Wellness for EMS. Yes, with our logo on there. We're going to be posting more about the Health and Hustle and how they can get signed up for that event and how they can attend. Even if they don't have a business, we would still love to have them there as an attendee.
Yes, because that's important. Even if they don't want to be the vendor or sponsor, just come out and see what we've got to offer. Yeah. And we're going to have some food. It's going to be a fun day and make it family friendly. I am still looking for somebody to help me make it family friendly. It's summertime, so moms and dads have their kids. You might bring your son, how old is he?
He's 15.
Never mind. He probably takes care of himself.
No, we've gotten him on the health journey.
Okay.
So he works out. He knows how important water is.
Good.
We actually have a problem where he goes through water too much. Like we buy cases and cases of water because he drinks a lot of it. So, but he's an athlete, so nutrition is very important to him. A wrestler, so weight matters.
Oh yeah.
So we don't have as much of a health problem that we have to worry about with him.
That's good. No, that's really good. Most kids are like, they don't really care.
Yeah.
How can people learn more about Hydro Hero?
They can come to Health and Hustle because I'm going to be there as well.
Yeah. Are you going to do anything? Are you going to have like your bags or?
Yeah, we're going to have a setup. We're going to show all the vitamins that we have.
Good.
We don't hide anything. I will show you the back of the vials and show you exactly what's in it because
transparency is important.
What's in it is important.
It is. And when you're injecting that in your veins, you want to make sure it's the right stuff. Because like you said, there is some scary stuff that can happen, but only if it's somebody not like you who's really not on top of all the issues. Businesses will be able to participate in Health and Hustle. They can go to your Wellness for EMS Facebook page, or they can go to truthin.health. And if you can leave our listeners with one message, what would that be?
To listen to your body. Your body's going to tell you what's wrong. Maybe not directly. It'll tell you something's wrong.
Yeah, that's very wise advice. And everybody can listen to their body because they live in their body. We are given this body and we have a very short life. And if we don't take care of it, that life is even shorter, or it's really no quality. So we want to make sure we're giving people the information they need so they can have a better quality and longer life. So be part of Health and Hustle. And thank you for your time today, Kallie.
Thank you for having me.
I had to keep saying her name because I was saying it wrong.
No, I definitely, ever since I found out about you guys, it's been great. Like what you guys do and just how you guys help is different. And I love it. I really wish more people would take the time to come and just find out what you guys can do for them.
Thanks. Yeah, vice versa. I just think that we're going to build something really cool, and we're going to build something that everybody's going to need. And from kids to granny, it doesn't matter the age. They're all going to need it.
Yeah, for sure.
Thank you so much. This month. Okay.